Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast, dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today I want to talk to you guys about chiropractic medicine versus osteopathic medicine. Not that they're directly in opposition from each other by any means, but I want to talk a little bit about their similarities and differences. Previously, we discussed complementary and alternative medicine, and while some folks consider chiropractic care to fall into that category, a lot of chiropractors do not feel that that really fits for them because they feel that it may relegate them into a role associated with pseudoscience. So we're going to talk a little bit about whether chiropractic care is scientific in any way, whether that really matters in the end, as well as introducing the concepts of doctors of osteopathic medicine instead of an MD and what that can really do for you guys. So for me, I grew up going to the chiropractor. I have had my spine manipulated several times over the years, and in my personal experience, it has worked really well for me. I had good chiropractors. One diagnosed my scoliosis, which I definitely have, and a biological anthropologist has also checked that out because it's very apparent in my back. But by the time they found it, they were not able to do anything about it via other types of medical intervention because I was already an adult at that point. I was, 18 to 20. So as far as my spine was concerned, there was not much more I could do to change that since I was pretty much already in adulthood. So really, it was very helpful for me. I only had the one x-ray that one time when it was actually called for, and overall I have had some great success with pain management with chiropractors over the years. So that's my personal experience in a nutshell. But now we're going to talk about what exactly chiropractors do. So if you haven't been to one before, or if you're skeptical or just questioning as to whether this might be for you, I have a lot of information for y'all today. So, what does a chiropractor do? If someone's recently recommended to you to go check one out, here's a little bit to help. They are healthcare professionals who specialize in treating and diagnosing neuromuscular disorders. Now, I will go ahead and let you guys know up front, this is coming from a chiropractor website. So they are already pro-chiropractors at this point. We're going to talk about it from a more skeptical point of view of another chiropractor later on. But they get special training in how to manually adjust your spine, like techniques to work on that for you and help you out with realignment. Now, that can be in different parts of the body. A lot of people think of it as just being your back. They're like, go ahead and let's go to the chiropractor and get my back cracked like a glow stick. And I'm here for that too. But you can also get your lower body worked on too, so your hips. I have some hip pain routinely, and going to the chiropractor has helped me with that. So normally, if you don't ask for that, then they might just do your back portion of your spine. But you can also request that they work on your hips and on your neck. But a good chiropractor will really make sure that you're asked where you're in pain so that they can really address all of it. So in addition to your neck and your back, chiropractors can work on your hips. I've also had them pull on my legs at a certain point to also help with my hip pain and everything. But they can't do that for one leg because I have a bum knee, which I've talked to you guys about before. So I have a good chiropractor I've gone to who has a really great grasp of a more holistic approach and a more scientific approach. So they make sure to ask about injuries beforehand. If your chiropractor does not ask about injuries beforehand, then go the other way. Because if you have a metal rod in your back from scoliosis surgery or something, or you have anything else going on regarding bone, muscle, or joint issues, then that can really be negatively impacted by some types of chiropractic care. And if they aren't thinking to ask you about that beforehand, then in that case, I would say they very well may be quacks. But I have also found a lot of great chiropractors. So when they do these alignments in your spine, these realignments, then, those can be related to health issues. And the goal of going to a chiropractor is to reduce pain that you may be experiencing in your day-to-day life, or if you are just having acute pain periodically and it's not like a chronic all the time thing, then sometimes that can be really helpful. It's not a replacement for medical treatment though. If you have fractures and stuff going on, you're not going to be able to get that fixed by a chiropractor. And in fact, it can do a lot more damage. You need to make sure you go to a regular doctor for that if you have any broken or fractured bones or you suspect that you have a slip disc or something like that. They also say that it can help you improve the overall function of your body. Chiropractors are really big into teaching the patients about what's going on as well. They don't really want to just be your go-to health provider. In general, if they're a good chiropractor, they want to be there to help you out a lot. So when I go to my chiropractor here in town, I was driving, it ended up being an hour to an hour and a half to get to him at one point. It should have been 45 minutes. But if you guys have ever driven on I-35 in the Austin-San Antonio corridor, they've been working on that traffic for years. I swear they're working on the same sections. They're building the same bridge that they were when I moved here 8 years ago. But I digress. But it was worth it for me to get that level of care. And I really connected with that one doctor. So he would talk to me about, well, I shouldn't call him a doctor necessarily. He's a chiropractor. So my chiropractor was really great about just being candid with me. And I was saying hey man, my hips are really hurting a lot. And I have my leg up on the recliner all day because my knee hurts and I'm trying to straighten it out to help it not be in as much pain. But then I end up making my hips hurt because I'm sitting in this recliner. And he's like, yeah, a recliner will do that. And he told me a story about how he used to be in the recliner all the time following his divorce, and that, he was playing video games with his buddy for 2 hours every night or so, and it, messed up the alignment in his own spine. And so he was like, I had to get rid of that recliner, even though it was my fave. And that really helped me out a lot. So I have 2 couches in my house. One of them is a recliner, the other is not. So I had to move off of that recliner and just pop up my foot on a box or something in the floor to make up for how short my legs are. So it wasn't tugging on my lumbar spine anymore. And that helped me out a lot. And he told me that knowing that fixing that for me, just educating me, was going to mean that I was not going to need to come in there anymore. So that's really what a good chiropractor does. They're trying to help you reduce pain in your life and not try to get you to come in all the time. He also taught me about fish pose and encouraged me to get a yoga block, showed me how you were supposed to perform these movements and how to not injure yourself doing it, and also pointed out how you should really be focusing on stretching each day for my own pain. Like, he tailored it to me. So with scoliosis, a lot of times that means some of the muscles are less used on one side of your body because you're going to favor it. And you really are going to end up essentially with shorter muscles on one side. And I went to school for biological anthropology. I am well acquainted with anatomy and osteology. So he didn't say anything that I did not really already know. And the bright side of that is that I was able to verify that what he was saying to me was correct. But it was very helpful, and he reminded me, hey, it's really easy to, get patients to do the exercises and the preventive care when their bodies are already hurting. But if you don't want to be in pain all the time, then you really have to do these even on days when you're not hurting, and especially on days when you're not hurting, because it's going to make sure that you perhaps don't hurt. So pain management is about doing it even and especially when you are not already in pain. And since their goal is to reduce pain, then that was really helpful for me. And I ended up not having to go as much. He knew that that was what was going to be the outcome. And so his goal was to help me not experience pain so much instead of padding his bottom line in getting a patient in all the time. So a good chiropractor will educate you as a patient, and they will talk to you holistically about what's going on. And so he asked me, are you spending a lot of time in a recliner? Because I actually didn't tell him that up front. He asked me that because it sounded very similar to his own pain, and he was educated in different things that could cause that problem. And I was like, yeah, how'd you know that? And he told me his story. So he was very relatable as well. He had a very good bedside manner. Although I've also been to a chiropractor who did not have a great bedside manner. But I only went to that one once. Remember, you can shake it up and go to different practitioners if you have them available in your area, of course. I understand some places only have one, depending on how rural you are. But in general, they will teach you about your health, exercise, and ergonomics to improve your quality of life, and they're really focusing on wellness. They will also talk to you about biomechanical issues, so how your body moves, how your muscles and bones interplay for, impacting function on your nervous system and pain in general. I focused on biomechanics in my graduate degree, so again, I like to talk to them about that when I first go in so I can gauge whether or not they really know what they're talking about. And for me, that's a really good way to info gather. I understand that not everyone majored in biomechanics, but that's why I'm here, to go ahead and help you guys figure out the right questions to ask to figure out if they are right for you. But in general, chiropractors can help treat, remember not cure, but in general just treat repetitive injuries, headaches, migraines, sciatica, pain from arthritis, neck pain, sports injuries, lower back pain, stuff like that. They also say that they can help you with auto accident injuries, but make sure that if you are in an auto accident, you don't just skip it and go straight to the chiropractor. You should be evaluated by a medical doctor first. That way you can make sure that you don't have any fractures or anything going on in your body that may be causing that problem as well. So, we are going to go on a quick break, and when we come back, we're going to talk about what a rational chiropractor can do for you. You really can't underestimate the importance of having the right creative work for your brand or your product. Whether it's a logo, a website, a book cover, or an ad campaign, you really need a quality design to make that big difference pop and deliver your overall engagement and success in a competitive market. That's where Design Crowd comes in. Design Crowd has over 750,000 designers from Sydney to San Francisco ready to help you with awesome creative ideas. They make crowdsourcing work for you. So if you need a logo or you're working on your creative branding, you can go to designcrowd.com and post a brief describing the design you need. And then within about 2 to 7 days, you'll receive up to over 100 different designs from designers around the world. Then you pick the best design and approve payment to the designer. So you're only paying for the design that you want. It takes a lot of the guesswork out of freelancing and out of crowdsourcing. And you don't have to be a huge company like Harvard Business School to use Design Crowd, although they have used it as well. You can start a project on Design Crowd for as little as $99. And if you go right now to designcrowd.com/health and wellness or enter the promo code health and wellness on their website, then our health and wellness listeners will receive up to $150 off of your design project. That's designcrowd.com/health and wellness or entering that promo code health and wellness.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
We were talking about what chiropractors do in general and what their purpose is. So now we're going to talk a little bit about what a rational chiropractor can do for you. So this was written by an actual chiropractor named Dr. Samuel Homola. So he has a doctorate of chiropractic medicine, and he says, hey, you should have a healthy amount of skepticism because there are people out there who will try to take advantage of you by treating chiropractic medicine in a certain way. So he has some tips for us in how to know what is good versus bad in a chiropractor. Now, he says that spinal manipulation can relieve. Now, keep in mind how he uses language here because he is very cautious about this. Chiropractic medicine does not come in the form of a cure. It is a treatment and a pain management technique for the most part. It can relieve some types of back and neck pain and other conditions related to tightness and loss of mobility. So when we say tightness, we mean like muscle tightness. Remember, your muscles are anchored to your bones, and they are anchored to other muscles through ligaments and tendons. So if we are not flexible and we don't stretch or anything and we're in the same positions most of the day, like a lot of us are by sitting at our desks or at our cars or on the couch watching TV, but if we're relaxing, if we're at work, if we are driving to one place or the other, we spend a lot of our time sitting in that same position, and that can result in muscle tightness. So it's important for everyone to work on their flexibility. I do think that flexibility and stretching is one of the most underrated components of health and overall wellness. And this is something that chiropractors can focus on for you. So tension headaches, aching muscles and joints, that type of pain relief is really what you're going for with a chiropractor. You can also go ahead and stretch at home. A good chiropractor will also tell you that and can often recommend some specific stretching exercises for the specific problems that you're having. So I always sit with my one shoulder rotated forward farther than the other, and part of that is because of my scoliosis. So it's the shoulder on the side that the muscles are shorter on. And I didn't realize I was doing that for a long time. So there's a specific pose in yoga that I do for that, the fish pose, and you have a yoga block at a very specific point under your back, and you have to be very specific with it so you don't injure yourself. And when you go ahead and stretch out on your back and move your arms a little bit, it helps stretch out those muscles. And we're trying to do it far enough to get a solid stretch where it's pulling a little bit, but not so much that it's really hurting. If you feel any sharp pain when you're doing yoga or flexibility stretches, you should stop so that you don't hurt yourself. However, there are a lot of different ways to do this. And my chiropractor that I saw, I also went in tandem with my best friend when I had her in town. And she is a hairdresser. So she is bent forward with her shoulders forward all day, cutting people's hair. Think about how your hairdresser has to move around your body and around you in the chair and cut your hair and also hold the comb and stuff in the other hand. So you can see, if you have that same visual that I have right now, that their shoulders are rotated forward because their arms are in there. So it's almost like they're giving you a hug in this type of frame that they have to hold all day, but also with holding scissors and stuff. So that can make them more prone to tendonitis or carpal tunnel, and also to having a very similar type of shortening of the muscles and muscle and joint pain and tightness that I have with rotating that shoulder forward. So we ended up getting very similar techniques for that. I had additional ones because I had other stuff going on as well, but it's helped both of us very well. And he has also given her some additional stuff to do in a different type of stretch because it is both arms for her. And we feel a lot of relief from it. So we'll message each other and go, hey, have you done your stretching today? And really, that's all he did was teach us the correct stretch to help alleviate that tightness. He also cracked our backs for us, and that was super helpful as well for the immediate pain relief. But this was about also training our bodies to not be in pain all the time by taking better care of them. We just really underestimated the importance of flexibility and how we need to do it every day. And thanks to him, I'm more flexible now. So I really took that to heart. I can do my tripods and stuff, the headstands with your hands on the ground too. So 3, your head and each of your hands on the ground and all that stuff. And it's really helped me a lot with my flexibility. I'm crazy flexible, you guys, and I did not expect to be at this point. I still have a lot of work to do to get even more flexible, but that is something that was a little life-changing for me that my chiropractor recommended just for my overall health. And I'm not going to lie, I am in a lot less pain all the time, and so I am less stressed, and my muscles don't feel as bunched up and tight all the time because I also don't have that cortisol flowing through my body all the time from being stressed and in pain. So I was kind of in a positive feedback cycle, and he helped me break out of that by really talking to me about the tightness in my muscles from the scoliosis and also from stress and the way I was sitting, because trying to fix my knee in one way was making my hips hurt. So I was just hurting myself repeatedly all the way around. And instead of kind of babying my knee, now I put it through more range of motion exercises. I'm more dedicated to that at this point. And, doing the bike machine helps a lot. And leg presses to strengthen the muscles around that knee joint has been really helpful. Now, there are a lot of different types of techniques they can also offer you, and basic advice about nutrition and weight loss, relaxation techniques like we talked about the other day with the progressive muscle relaxation. I didn't get that from a chiropractor, but they probably know a lot about that too. They can also talk to you about body mechanics or biomechanics and home care, like when to use hot versus cold packs, massage, stuff like that. There are science-based chiropractors out there, and they can make good judgments about the nature of your problems and determine whether that lies in their scope of support or if this is something that you should really be seeing a neurologist for or an osteologist and going into a different type of healthcare practitioner for you. If they are willing to refer you out, that means, in my opinion, that they are more legitimate because they're not just trying to take your money. They are trying to help you in your path to having less pain and better wellness. Now, if you can find someone who is a chiropractor and uses manipulation and physical therapy appropriately, like we do for my knee with my chiropractor and with my hips and everything, and if they will coordinate with your personal physician, you can really have it all, essentially, at that point. If you can get them to coordinate with your personal physician, then it's going to be very well-rounded and holistic healthcare, the type that we're really going for. Now, some types of back pain can benefit from spinal manipulation, but not everyone who goes to a chiropractor is going to need spinal manipulation, and not all types of back pain can really benefit from it. You want to make sure that you get a solid diagnosis before, they start cracking your back. If you just walk in and they start cracking your back and you have not talked to them about any of this before and you're a first-time patient and they're not familiar with your medical history, get up off that table and walk out. That is not good. If you consult a chiropractor, make sure that you get one who only does spinal manipulation when it's indicated. If they tell you that to start out you're going to need a full body x-ray, you need to leave. If they are saying that they are going to prescribe you some kind of homeopathic medicine, that person is probably a shyster in my general experience. And in the experience of Dr. Hamola here, he practiced chiropractic medicine for a very long time, several decades before he retired. And he is telling you as a fellow chiropractor, hey, be wary of these people. He's not saying don't use homeopathic medicine or anything like that or herbal supplements. He's saying don't go to somebody who's going to say they're prescribing it to you, because those people are essentially more like snake oil salesmen in his opinion. And I tend to concur. So if you have been diagnosed with musculoskeletal pain and you are feeling kind of off-put or concerned about maybe getting spinal manipulation, ask your doctor, your regular primary care practitioner, whether a referral for physical therapy works for you, if that's right for you. There is a full physical therapy suite near my doctor. It's in the same medical complex, but it's a different company, and they do both chiropractic care as well as massage. It's about pain management treatment and physical therapy. So that area is really science-based, and I appreciate them, and I know a couple of people who use it and have really enjoyed it. So if a chiropractor tells you that he believes in subluxation and that, subluxation is real. It just means that your bone is out of where it should be. It's out of place by just a little bit. It doesn't mean, your kneecap has traveled to your spine or anything like that, but just that it's a little out of place from where it should be aligned. If they say that they think that 95% of all diseases is caused by subluxation of any bone, then you should really get out of there. That is considered to be pseudoscience at that point, even amongst most chiropractors. So most chiropractors will tell you that that is pseudoscience. It's based on this guy from like the 1800s, I think, who went ahead and popped somebody's back once, and it allegedly cured that guy's hearing. And so the guy was like, oh yeah, we're going to go ahead and say that this causes 95% of all problems. We talk a lot about statistics on here, and remember, one does not a sample size make. So this guy drew a conclusion from a single encounter, and that is really not appropriate. It's bad science. It's terrible science, in fact. So we're not going to follow along with the subluxation theory. It is not grounded in any type of science. All right, we're going to go another break, and when we come back, we're going to talk about the difference between manipulation and mobilization in chiropractic care to really give you guys the vocabulary to ask the right questions of your chiropractors.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
talking about some healthy skepticism in picking out a chiropractor and how it's important that they are able to go ahead and diagnose you first before jumping in to manipulate your spine. Because even if you go to see a chiropractor frequently, it's not always appropriate or necessary to get spinal manipulation. You can also ask your doctor, your primary care practitioner, if seeing a chiropractor may be right for you for the type of musculoskeletal pain that you're experiencing. They did a study in 1998 in the New England Journal of Medicine, and they found that the long-term effectiveness of chiropractic manipulation was no better or it was not statistically significantly different than the McKenzie method of physical therapy, which is just an exercise program. So it's saying that long-term use of chiropractic manipulation didn't help anyone resolve a problem any better than getting exercise frequently. So that just goes back to making sure that we are working on our flexibility and stretching, because remember, we want healthy, flexible muscles. We don't just want strong muscles. If you just have strong muscles, then they may be more prone to rupturing or tearing or any form of injury, really. We need to make sure that they are flexible in addition to being strong. So guys, especially I'm talking to you right now, if you're doing a lot of weightlifting because you want to get jacked, or any of my ladies and gentledames out there who would like to get jacked, if you are trying to get bigger, make sure that you are still being flexible. You can be both flexible and jacked. Don't let anyone tell you that you can't be both. It's important to be doing your stretching at least once a week at a minimum. As part of your exercise routine. You can do that as yoga or Pilates or whatever works best for you. I just do a regular stretching exercise, and it's like a 14-minute video on, YouTube. It's really easy to follow along with. I can do it while I watch The Simpsons or something, and it's very chill and a good use of my time. It helps my body so much, especially like the hip openers in Pilates. That's one of the movements that we do in that video, and it makes my hips feel amazing. And often after I do those stretching exercises, my back will pop. Afterwards, my joints will just pop a little bit because they are able to not be so tightly bound by the muscles at that point. Everything in my body, my joints, my bones, and my muscles just feel a lot better. So that's what this study in the New England Journal of Medicine, which is a very well-respected medical journal that is peer-reviewed, found when they compared chiropractic manipulation in long-term versus just physical therapy or an exercise program. So go out there and stretch. Stretching is free. You don't need any extra materials for that. Just remember that we only stretch warm muscles. It doesn't matter if you stretch at the beginning of your workout or at the end of your workout. Everyone in the fitness industry tends to argue about that, and they don't know which one is better per se, but they do agree that we only stretch warm muscles. So don't get out of bed and decide you're immediately going to stretch those cold muscles. You need to warm them up a little bit. So, do a light 5 to 10 minute jog or something before you start your workout. Just make sure that you are warmed up, or after your workout, when your muscles are already warmed up, go ahead and stretch at that point. So, what is manipulation versus mobilization? What are these words that I'm throwing around that you really might want to know to talk to a chiropractor about? Those are two different things. Manipulation is a hands-on procedure that they use to restore normal movement by helping you loosen your joints and stretching those tight muscles. So that is what manipulation is. It's going to help you by really loosening up where your body is kind of stiff and tight. Sometimes you'll hear a popping sound when a spinal joint is stretched a little bit beyond its range of motion. And then when you have mobilization, that stretches your soft tissues, so your muscles and everything, by moving your joints through their full range of motion. So think about when you do the windmill arms thing, where you are getting ready to work out, and maybe you're doing a P90X video, and they have you put your arm forward and then send it back behind your body, and then forward and back behind your body on the other side, and then the reverse. So think kind of like motions you would make if you were swimming in a pool and you were doing like the breaststroke or something, that kind of windmill thing. So they have you do that for mobilization, and that helps you increase your range of motion. That's going to help you with your arms, your legs, and your shoulders. But for something like your spine that is, it doesn't have a huge range of motion really for most people, it will be more effective in general to have joint pain relief and get more normal movement in the spine by getting it manipulated. So manipulation is the popping actions, and mobilization is going to be just, stretching and range of motion exercises. So working out that rotator cuff, going ahead and doing some mobility exercises for your knees and your hips and stuff. So those are two different ones. Mobilization for mobility, manipulation, the popping. So there you go. That is the difference between those two terms when it comes to chiropractic vocabulary. If you have any part of your spine that's tight or stiff, or you have a lot of pain when you move, then you might really need appropriate manipulation. Now, we do want to make sure that it is appropriate and, well informed by science. There are different methods that you use in different portions of the spine, because if you take out your vertebrae and look at them, or if you've ever seen a skeleton, not all of the vertebrae look the same. We have 7 cervical vertebrae. Those are the ones in your neck, and those are going to look a little bit different because they are meant to hold up neck muscles and everything and anchor the base of your cranium to the rest of the trunk of your body. So for those, you also have the 2 at the top, the C1 and C2, your atlas and axis. Those are shaped very differently from all of the rest of them. They're very easy to identify if you're trained in skeletal anatomy. If you're given a pile of bones, those are usually the first 2 that you can pick out and go, okay, this is clearly C1 and C2. And they stack on each other a certain way and stack to the bottom of your cranium a certain way. Now, when you get down into the thoracic vertebrae, the ones in your thorax or your abdomen, the trunk of your body, there are 12 of those because you also have, 12 ribs. Yes. So part of their function is to have attachments on them to hold your ribs. So they anchor them in the back. And some of the ribs are anchored on the front to your breastbone, your sternum. And others are floating ribs, or they're considered false ribs because they're not really anchored to anything through cartilage or directly towards a lot of the other bones, but they're rather just, they come around in the corners. That's why it looks like a cage. Think about a skeleton, what that looks like with its rib cage. And then it has some that just kind of poke out a little bit at the bottom. Now, with those ribs, they just connect to the back in about 2 places into your spinal column for each rib. So they're called articular facets, and they connect to the ribs, they connect to the ribs and the articular facets on the vertebrae connect to each other, right? So they're really shallow joints. They're not like your hip joint where your femur, your thigh bone, is really in that socket. It's not a socket so much, it's just a facet. So it's very shallow, and they can become displaced in there. That is how your thoracic vertebra looks. And then towards the bottom, they start getting thicker. All of these bones get thicker bodies as they move down. And that is because they're having to hold more weight. Think about how much bigger your thighs tend to be than your arms, especially with the bones underneath the muscle. You're going to have thicker lumbar vertebrae. They tend to be hardier unless there is something wrong. And they're generally about 5, and they stack on top of your sacral spine as well. Your sacrum is the one that generally tends to fuse as you go along. And sometimes you can have an extra sacral element, or you can have an extra lumbar vertebra. Most people have the 7, 12, 5 arrangement and then the sacrum. But some people have more or fewer. It's not really that uncommon. So when you're working on those, because they're shaped differently and they do different things, like mostly weight bearing versus, stability for the neck versus, anchoring the ribs and the muscles of the trunk, there's a lot going on with these vertebrae. So they have different manipulation techniques to help you for different parts of your spine because their structure and their function, which is what anatomy and physiology respectively mean, are very different. So if they're like, okay, we need to do something different down here, that's why. Now there is some neck manipulation that they can do while you're sitting on a stool. They can do the upper back manipulation while you're lying face down on those funny little tables and stuff that have a hole cut out for your face. And then they can also do lower back manipulation while you lie on one side. They can also do that while you are laying down flat. It just depends. Different ones are better for different things. When I get my hips popped for my lower back, then I lay that on one side and one leg stays kind of straightish. The other one comes up, and then there's a strange movement. I can't really explain it that well without showing you guys, but the spine is pushed in kind of two different directions. So my hip is going one way, my spine's going the other a little bit, and it pops it a little bit, and it just alleviates a lot of that pain. But that's why if you just ask them to do your spine, you're only going to get pretty much your thoracic spine worked on for the most part. So if you're having hip pain or neck pain, you need to tell them more than just my back hurts. Be specific with it because there are different things that they can and will do for you in that manner. Now, we're going to go on another break, and when we come back, we're going to go in depth about these different types of muscles and joint manipulation.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. In our last segment, we were talking about the difference between manipulation and mobilization, and also how the spine is really structured and how it functions differently with different components, and therefore how the manipulation is a little bit different based on which part of your body is hurting. So make sure that if a specific part of you is hurting, that you really specify that to your doctor or to your chiropractic healthcare professional so that they can have a whole picture of what we really need to work on for you that day. The neck manipulation can really help your cervical spine. So those 7 at the top where your neck is. Yes, neck is. And if it's been stiffened by osteoarthritis or scar tissue from an old injury, then they can generally manipulate that a little bit to help you with your range of motion and with your pain management. So neck manipulation, which is the popping, and then like the mobilization, your joint mobility, can really help you with that range of motion and also with neck pain or muscle tension headaches. I'm prone to muscle tension headaches, and when I go to the chiropractor, sometimes he will even give me a light massage for a minute at the base of my skull where my neck is really meeting my cranium. He also will do it a little bit where my neck meets the trunk of my body. So just pretty much my neck in general. And it's really been efficacious for me in getting my muscles to loosen up a little bit and reduce my headaches. At one point, I'd had the same headache for like 4 days straight, and I finally just went to the chiropractor, and I'm like, dude, everything hurts. Can you please help me? Like, my whole spine is hurting and I can't sleep. And he went ahead and did the light massage for it, got those muscles warmed up, and then did some neck manipulation and mobilization techniques with me. And that headache was gone within a couple of hours. It dissipated after that. It was magical. Now, would it have gone away on its own without that? I have no idea. This is the timeline I'm living in which I went to him and he did the manipulation and I felt that I felt better. So for me, even if it was a placebo effect, it was still an effect in a positive manner. So you guys know that that's where I kind of stand on that subject. Now, when you are symptom-free from whatever was going on with your neck manipulation and your neck pain, then we don't do it anymore. We don't want to advocate really for neck manipulation to balance or realign your spine if you're not having problems in your neck, if you're not having pain in your neck. If your chiropractor is insistent upon doing that no matter where your pain is, then a lot of, scientific and ethical chiropractors will recommend that you avoid visiting those types of chiropractors. You only want neck manipulation if you have specific symptoms that indicate a need for it. And they have to be very gentle about it to make sure you don't rotate those neck muscles and those neck vertebrae too far because it can damage your vertebral artery. That can be very dangerous. You should also not go get neck manipulation from a chiropractor if you've had a very recent injury that's causing you acute neck pain. So not for like whiplash and stuff like that. Remember, you want to go to a PCP first, a primary care practitioner, rather than going straight to the chiropractor. You want to ideally have them keep the neck manipulation and the rotation within 50 degrees. They say that as scientific practitioners of chiropractic care, that at 50 degrees, that's as far as you want to go. And when the rotation is not indicated or really necessary, then they can do some different techniques with you in a face down position so that they can manipulate it for that popping, or there can be thumb contact with certain segments of your cervical spine, so your neck. So it's not always necessary to do that thing where it looks really scary, where they're like cracking their necks, or your neck and everything like you see in movies and everything. There are different ways that they can do it. Sometimes you don't need to rotate it for it. It's not necessarily a mobility issue at that point where you don't need to rotate it to pop, because that's not the actual underlying problem. So if you feel like your chiropractor is giving you just a one-size-fits-all solution, then that may not be the chiropractic practitioner for you. If you have joint inflammation, most of the time you're not going to benefit from neck manipulation. I mean that for rheumatoid arthritis or spondylitis. Any damage to your upper cervical connective tissues can really say, hey, you shouldn't be doing this. So in addition to there being necessary indicators of something, there can also be what we call contraindicators. And that is a medical term in general, not just using chiropractic care, but in all of healthcare, where it's saying, hey, if you have this going on in your body, you definitely should not get this type of care. We're going to completely rule that out. So for example, one of my other best friends has that rod in her spine from when she had scoliosis. So even though she has pain associated in that area of her back from the rod and the scoliosis, she can't go to a chiropractor for that because it is contraindicated. If you have a rod in your spine at that point, they are not able to manipulate your spine there because that could cause more problems instead. It's going to be more harmful than helpful. So that's a contraindication. If you aren't sure about whether you should get neck manipulation, talk to an orthopedist. Talk to your bone doctor. A good chiropractor will not object to you seeing a specialist for a second opinion. So even if you go into your chiropractor and they're like, yeah, let's do neck manipulation. If you're like, I'm not sure, I have, inflammation in my body in that area, I want to talk to my orthopedist first, the person who is specialized in bones and everything. a good chiropractor is going to go, yeah, okay, go get a second opinion. Any good doctor is going to be down with you getting a second opinion because they recognize that that is you info gathering. And it's not about their ego. It's about your wellness and your healthcare and your comfort in making those decisions for your own body. So keep that in mind across the board. Now, if you have a true migraine, then it's unlikely to be relieved through those pain management techniques of neck manipulation. But if it's a tension headache, then that will often help it. So I have both migraines and tension headaches. The tension headaches go away when, I have the back of my neck massaged and stuff, whereas the migraine is very different. If you do have a type of persistent headache where it's just not going away, definitely talk to your family physician or a neurologist. I should have gone to one when I was having those headaches, but at the time I did not have health insurance. It was between jobs. And so I was like, okay, I need to go ahead and just see my chiropractor. So he was able to give me a massage and everything. But also I wasn't having any fever, vomiting, no changes in speech or vision or any other symptoms or like weakness in my body that would have really indicated I needed to see a doctor right then. So severe headaches, sometimes you need medical attention for the pain relief, but if you're not having any of those other symptoms, then, you make your decision for you. I do recommend going to a doctor if you are able to, though. But again, like in my situation, sometimes it is a matter of the American healthcare system and the crazy amounts of money they charge. If you have any kind of persistent pain in general, definitely talk to a medical practitioner, not just a chiropractic care practitioner, and to avoid, really getting cervical manipulation for headache treatment. Make sure that you realize whether your problem is really caused by like a sinus infection or food sensitivity or something unrelated to the cervical spine. Sometimes you have those headaches and it's not being caused by tension in your neck. So getting your neck manipulated is not going to be helpful. Sometimes brain tumors can also cause headaches. I'm not trying to scare you guys. That's just a fact. And so that's why if you're having persistent headaches, especially if they're accompanied by fever, vomiting, changes in speech and vision and stuff like that, that you should go talk to a primary care practitioner rather than just going to a chiropractor for it. A lot of headaches are just simple tension headaches or, also called muscle contraction related headaches. So a lot of times those can be helped by chiropractic manipulation. That's the good news. Sometimes just a simple massage too will help, or stretching out your neck muscles. A good chiropractor can also give you tips on that so that you don't have to come back in and have your spine manipulated for the pain relief. There was another study in 1998 in the Journal of the American Medical Association, another very well-respected medical journal, and found that cervical manipulation might not be any more effective than massage in treating episodic or recurring tension headaches. So people who have a lot of tension headaches or frequent ones, like I used to have, might want to try getting a massage first rather than go for cervical manipulation. And that is recommended by a chiropractor. I am still giving you recommendations from Dr. Hamola. So this is a chiropractor saying, hey, there are other options. There are other reasons that you might want to go and have this done instead. We're not going to take it personally. A good science-based chiropractor is going to want you to have your second opinions. They're going to want you to have a massage first rather than get cervical manipulation that may not work. We're going to go on another break. When we come back, we are going to talk about your other joints and muscles and tips on choosing a chiropractor.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about manipulation of the cervical spine and how that can really help you for tension headaches, but how it's not really indicated for different types of neck issues. So if you're having neck pain that is associated with inflammation, like rheumatoid arthritis and stuff like that, then you may not be wanting to go to a chiropractor for that. It can be contraindicated. So now we're going to talk a little bit about how this really affects the back. So the back is, one of the largest spans of our body, and you can have pain in the upper and lower portions of the spine, and that can be treated with manipulation and physical therapy. If you have low back pain, that's generally a lot more common, and it's also more serious and deserves more attention. You can get herniated discs in the upper back, or remember, your thoracic spine, where those 12 vertebrae are connected to your, to your ribs. But you can also get them in the lower back. You are way more likely to get them in your lower back, in your lumbar spine. And that can pinch your spinal nerves and result in a lot of weakness and loss of sensation in your legs. So you want to be very careful with that. If it's starting to impair bladder function or bowel function, that's called cauda equina syndrome. I may be pronouncing that wrong because it is a Latin term, but it means horse's tail. And so the reason it's called the horse's tail is because the way your nerves are arranged as they come down from your spinal cord and then branch throughout your body looks kind of like a horse's tail as it comes out now near your lumbar spine and your sacral spine. So it really does kind of look like a horse's tail if you Google like the way that the nervous system looks in your lower back. So Google that. You can also just Google horse's tail nerves and see what it looks like. But that's why it's called horse's tail syndrome, but in Latin. So the Agency for Healthcare Policy and Research recommends treating low back pain very mindfully. So they're kind of against manipulating the lumbar spine if you are also having leg pain, because that nerve root may be more of a problem. You may have a herniated disc instead, and that may just be pinching those spinal nerves. That means that maybe we should not be popping in that area. You might need to see a different type of healthcare practitioner. Now, when you have thoracic vertebrae that have been softened by disease or aging, or, we lose some of our hardness in our bones through osteoporosis and stuff as we get older, they're less solid at that point, then appropriate thoracic spine manipulation is generally not a good idea. So if you're having a lot of trouble with your back because of osteoporosis and stuff, maybe talk to your doctor first before you go to a chiropractor. You can, get some back relief related to fatigue, postural strain. So not having a good posture a lot can also cause your body to, get some of that pain in your neck and your back in those muscles. Arthritis, stuff like that, any problems involving the muscles and joints, that can often be treated by chiropractic care, especially if you have, I hesitate to say the word normal for, your thoracic spine and everything, but I just mean that nothing abnormal is going on. So if you don't have any issues related to disease or aging in your back, then generally a chiropractor can help you a lot with manipulation in your spine and regarding back pain. Now, a lot of people go get thoracic spine manipulation just because it feels relaxing when you get your back cracked. And, popping your back. You hear people say, crack it like a glow stick. And that is a lot like how it feels at the time in my experience. I think it's pretty apt of a description. And a lot of people just like how it feels, just like people enjoy the sensation of getting a massage. If you're having some back pain and it's just helping you relieve it, that's what a chiropractor's for. If you have any other diseases or illnesses going on, you might want to talk to your regular doctor about it first. For your other joints and muscles, if it's not a complicated mechanical problem, a biomechanical problem in your muscles and joints, then you can often go to a competent chiropractor who's science-based and uses physical therapy. They often know about how to treat extremity joints, like I told you about how they would work on my left leg, but could not do that for my right leg because I have an injury there. And they can help you with a lot more than just your back. A lot of people think of it as just the spine or just the spine as it relates to the back and the neck specifically. But they can also help you with the extremities if they are solid and science-based and are trained in physical therapy as they should be. But a lot of these joints, when you have pain in your extremities, a lot of times you need to work on the mobilization as well as just the manipulation. It's not enough to just pop them. We need to work on our joint mobility to prevent this from hurting as much in the future. So you may need an orthopedist or a physical therapist instead or in addition to the temporary pain relief brought by chiropractic care. If you go to a chiropractor, a lot of them have additional training in orthopedics or sports medicine, and those type of chiropractors can have more extensive knowledge of extremity injuries. So we're talking about extremities. We mean like, your shoulders, your elbows, wrists, knees, ankles. Your appendicular skeleton is what we refer to it as frequently. So it's talking about your appendages, your limbs, your arms and legs. So you might hear any of those terms used. Now, you should really go see a doctor if you need pain medication. If you need a prescription for that, you're not going to be able to really get that from a chiropractor. You're going to need to go see an orthopedist or something. If you have a dislocated joint or you need a broken bone set or something like that's going on, or you're having a big swollen knee and it's inflamed and you need it to be drained, go ahead and go to a primary care practitioner or an orthopedist, because a chiropractor with a diplomate in orthopedics or in sports medicine and mechanics can't really do much more than a physical therapist at that point, other than also manipulate your spine. Now, a lot of physical therapists now are moving towards manipulating the spine as well. Most of them just use mobilization techniques though. So you may want to see both at that point. Remember, we're looking at our body in a holistic manner, and that means our treatment of it and how we view it. And that's okay to go to multiple individuals for this. They're specialists for a reason. If you have pain in other joints, it's not as bad as shoulder pain in general. Not the pain amount, but rather what it may indicate. So shoulder pain may be associated with the problems with your heart or your lungs, or because of a herniated disc in your neck. Shoulder pain is not necessarily just related to the shoulder. And what you might think is coming from your musculoskeletal system may instead be associated with other related organ systems that are near that area of your body. So your heart and lungs are packed in there between your ribs, and it's right there behind your shoulder. Depends on whether you're on the scapula side or if you are on the collarbone side as to which side we're really talking about. But it's sandwiched in between there, those organ systems. It is really necessary to rule out bone tumors as well, or advanced forms of arthritis, before you start any type of long-term treatment plan with a chiropractor. shoulder pain can be, indicative of something else going on, and it might not be necessarily apparent to a chiropractor, or they may think that you have already been to see a doctor for it. A great chiropractor will ask you questions related to that if you are saying that you have chronic shoulder pain. Now, for choosing a chiropractor, if you decide to go to one, they recommend trying to find one who limits their practice to treating musculoskeletal problems in a conservative manner. And by that, they don't mean that, they vote red. They just mean that they're only going to manipulate your spine or do mobilization techniques as needed and not just insist on popping everything when you go in there. You want to talk to your family doctor as well about names of reputable chiropractors. A lot of times they will have strong feelings about the ones in their area. And they, who do you go to if you get your body hurt by an unscrupulous chiropractor? You would go to your primary care practitioner. So talk to your family doctor and they can tell you who may be trustworthy and competent and science-based in your area. If your doctor can't or won't provide a name, because doctors are people too who have their own beliefs about what is and is not effective, then ask some other people. Ask around. My old boss, who's a friend of mine, he recommended one for me. It's the Physical Therapy Center and Chiropractic Treatment Center that I told you guys was near the primary care practitioner I go see, and my PCP also recommended that group. So I got 2 different recommendations, one from a friend, one from my actual doctor, and they were for the same person. So I was like, okay, that sounds legit. I'm going to go see them. But if the chiropractor that you're going to claims that they treat infections or some wide range of other diseases, go somewhere else. That is an indication that you should not be there with that person. You can't just rely on going into the yellow pages. For everyone who's a millennial, if you guys remember that, my millennials and my boomers and Gen Xers, Gen Z, the yellow pages were like Google, but in a book of telephone numbers way back when. You guys might not be familiar with that, but don't just rely on Google for finding another doctor. You should, or another chiropractic practitioner. Make sure that you avoid chiropractors who make extravagant claims, like they say that they can fix 100% of your problems and stuff like that, or that they are the best chiropractor this side of the Mississippi or something. That's called puffery. They're legally allowed to say that in advertising because it's considered to be like puffing your chest out or like peacocking. It doesn't have to actually be true, but it's not technically a lie per se because it is implied that you understand that they're not the quote-unquote world's best chiropractor. So be careful, be mindful about when you're selecting a chiropractor if they're advertising a lot. And if you have selected a chiropractor, go get a consultation or call them. You can have a phone interview to see how they practice. If they treat infants, offer spinal adjustments as treatments for visceral diseases like organ-related diseases or infection, or they tell you that you have to keep going to the chiropractor to prevent ill health, like not just, pain treatment and pain management, but going, oh yeah, if you want to make sure you don't get the flu or whatever, come see me a lot. That apple a day kind of thing. Or requiring that everyone gets an x-ray, or if you have to schedule a bunch of payments in advance for long courses of treatment, then you should call another chiropractor. They really recommend being wary of those types of individuals. They do need to diagnose you because you have to have a diagnosis in order to have proper treatment. So also if you go in somewhere and they're like, okay, just lay down and we're going to pop your back and get you out of here. That person is just there to make a buck. They are not really caring about your health or wellness. So get out of there. It really comes down to just like any other type of medicine or treatment. Some chiropractors are competent in diagnosis and some are not. So if you go to chiropractors who only examine the spine and think that the subluxated vertebrae are the primary cause of 95% of illnesses, then you might want to avoid them. If they say they're going to analyze the spine rather than offering you a diagnosis, you may want to avoid them as well. And it is okay to walk out of your appointment and just go, I'm not comfortable with you touching my spine. I want you guys to be confident enough in caring for your health and wellness to be able to say, no, I don't want that. That's really important for our emotional wellness in general and our spiritual wellness, to be able to say no or to stop people in their tracks. And it may be very difficult for us in the moment, but I want you guys to just try to keep that in mind, that it's okay to say no. I'm not going to judge you for that. And if they judge you for it, who cares? You're not going to ever see those people again. You're leaving that chiropractic office. So it's more about your individual health. You don't have to be nice at the expense of your health. If you're getting that gut feeling that's like, okay, this guy just said analyze and stuff instead, and he's talking about subluxations, I need to get out of here. You don't have to submit to the exam and then leave and just never come back. You can go ahead and leave in the middle of it. They might still charge you, but at the end of the day, at least you don't have somebody who is talking about these subluxations and analyzing your spine. So they're already talking in a questionable manner. How well do you think that they are versed in treating these things? It's up to you. I just give you guys the information so you can make up your minds, but I want you to have all the information. And remember, this is coming from a chiropractor who says you should have a lot of healthy skepticism. If you have trouble evaluating chiropractors and figuring out whether they are great or if they are quacks, then you want to go ahead and just avoid them. It's like if you're asking if someone's interested in you. If you have trouble telling if that person is interested in you or not, then generally that answer is no. And wouldn't you be more comfortable in participating in any type of relationship with someone when you know that they really do want to be there and they are there to do what they say they're going to do and they are confident about it? So if you are not confident and you don't know if that person is interested in you, same thing goes for the chiropractor. If you're not sure if they're a quack or not, go find someone else. If there's any question about it, just go look for someone else. You can also try to talk to them about whether they're willing to work with your family physician by exchanging office notes. That's going to be a good indicator. If they say yes, then it's like, okay, they're not afraid to speak with a physician at this point. They're not afraid to talk to a primary care physician. They're not offended by this because they are confident in their ability to actually give me a solid diagnosis and treatment. They don't feel like their practice is being called into question because they know the science and stuff behind it. So that's a good way to just do a gut check on it. Once you do find a good, rational chiropractor, you can find some really effective relief for certain types of back and neck pain and for a bunch of other musculoskeletal problems. Remember, they can't treat infections or disease per se, but they can help you with your musculoskeletal system. You might also get a lot of great experiences from having hands-on treatment. I just feel really relaxed after I go see a chiropractor. Again, I've said it before to you guys, it's no different for me really in regards to how my body feels seeing a chiropractor versus seeing a massage therapist. I still just feel really relaxed and chill afterwards, and it makes me want to have a very long nap because I'm just not in pain anymore. So you can see both. You can see either. Just see what's right for you. That's the important component. All right. We're going to go on another break, and when we come back, we're going to talk about choosing between a chiropractor and an osteopathic doctor for your personal pain. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
we're talking about seeing a chiropractor for your back pain and how to find a really good chiropractor. So now that you know how to find a good chiropractor, we're going to talk about osteopathic medicine briefly and determining whether you should see an osteopath or a chiropractor for back pain. Now, these are two different types of healthcare practitioners, and they both believe that having a healthy spine is very important for your overall health and wellness. There are some big differences, though. So we're going to talk about osteopaths now that we've really discussed chiropractors. Osteopathy means that they are generally studying the relationship between musculoskeletal systems and your overall health. It's a very holistic form of medicine, and it's a very holistic approach that is different from most approaches in Western medicine. Western medicine is going to give you an MD, is what it does. So the MD that goes after your name, if you're a doctor, so you're a medical doctor, that's what that indicates. It's more Western medicine. If you have a doctorate of osteopathic medicine, then it's called a DO. The osteopaths trained in American and European countries call themselves DO. If you are American trained as an osteopath, they will call you a doctor of osteopathic medicine. But if you're over in Europe, then it's called a diploma of osteopathy. So we're going to mostly focus on the ones in the U.S. today because that is where you guys are. Osteopathy was founded in the 1870s. And according to the American Association of Colleges of Osteopathic Medicine, it's a distinctive form of medical care founded on the idea that all the body systems are interrelated and dependent on one another for good health. So again, I like DOs because it's a holistic perspective. They're going to talk about your mental health. They want to know about your stress levels in addition to any musculoskeletal pain and skincare, like everything. It's very important, just depending on your individual issues, figuring out what is best for you as an individual. It's not so much a one-size-fits-all like it is with MDs. So with the chiropractors, conversely, they believe that the structure of your spine and how it functions affects your musculoskeletal and neurological system. So it's a little bit different in that regard, whereas osteopaths are looking at your entire body and your overall health and wellness. Chiropractors do believe in holistic functioning, but they mostly are focused on how your musculoskeletal system and your neurological systems are related to each other. So removing and not entirely curing, when I say remove, but relieving or treating pain in your musculoskeletal system. And your pain comes from nerves, your nervous system, so your neurological system, your brain, spinal cord, and nerves. So they believe that that is all interrelated as well. Now, chiropractors treat pain by manipulating the spine and doing mobilization techniques with you, and they also think that if the spine is in proper alignment, the body will be able to heal itself in some ways. They do not necessarily have medical training, and they do not prescribe medications. They're not allowed to do that. DOs, on the other hand, can prescribe medications. They are medically trained, and they have to go through the same type of residency programs that MDs do. So they have to be accredited and everything. Now, chiropractors and osteopaths are going to agree with each other that spinal health influences overall health. They think that working on your spine is going to help optimize how your nervous system works, how your brain and your spinal cord and your nerves work in your body, and improve your blood flow throughout your body. So they will both manipulate joints and sometimes massage muscles and tissue. And their goal for each of them is to relieve those aches and pains in the body. However, sometimes they're going to have secondary goals too. So if you're having trouble with digestion or circulation or headaches and stuff, then they're going to talk to you more about that as well. They often will observe and touch your back to diagnose you. Now, the big difference is chiropractors are more narrowed in on aligning the spine. That's what they're focusing on to prevent pinched nerves and stuff. Whereas osteopaths look at the whole body holistically and focus on its structure. They can also treat way more disorders because chiropractors are limited to mostly muscle and joint pain. If they are saying that they can treat a broad range of disorders, remember that other chiropractors who consider themselves rational and science-based say you should avoid them. Go see a DO instead. Your choices aren't chiropractor or bust. You can go and see another type of holistic doctor called a DO that a lot of people, I think, are not aware of. So chiropractors will use x-rays and MRIs sometimes, whereas osteopaths are going to do more of a physical exam and will refer you out if they think that you need more diagnostic procedures. Osteopaths go ahead and use a wider variety of techniques to manipulate your body's healing systems. They do more muscle and soft tissue work. They may manipulate other joints in your body as well, whereas chiropractors mainly focus on your vertebrae. Although remember, they can do joints of the extremity if they are well trained in physical therapy as well. So chiropractic visits tend to be pretty much in and out, 10 minutes, 15 minutes usually, and they are just really getting your back adjusted or your spine adjusted, and then you're heading out. Osteopaths, because they are so holistic and they're looking at a much broader picture, are going to generally take more time with you. They need to spread your treatment out a little bit more generally because they are spending so much time talking to you. They want to make sure that they're getting down to the root of what is causing this problem. And if there are multiple causal agents involved, getting down to the roots of it. So when you're trying to decide between seeing a chiropractor or an osteopath, that's just a personal choice that we each have to make for ourselves. So what exactly are you wanting to address with this? Are you wanting a cure, or are you just wanting a treatment and some pain relief? Do you know for a fact that it's just something where you need to have your back popped and then you're going to feel better, and this is not something you need to do frequently? Or do you have more questions about what's going on? Are you having pain in your shoulder joint specifically, especially if it's going to be over your heart and lungs? Then you might want to see an osteopath in that case instead of a chiropractor. So make an appointment with a DO. And you can Google those online and find local DOs. Remember, they have to be medically accredited and they can prescribe medication. So they've been through a larger accreditation process than a lot of chiropractors have. If you have a really complicated problem, like it's in most of your joints and tissues, and it's not just limited to your spinal cord area, like it's not limited to your vertebrae and your hips. If it's going everywhere else, then you might want to go see an osteopath. If it's just temporary relief of back pain and you don't have any suspicions that you may have a fracture or anything, then you may want to just go to a chiropractor. If it's something that you think you could go to a massage therapist for and feel a lot better, having just gotten a massage, then go see a chiropractor. If you feel that you need to see a doctor for something, then you should go see an osteopath. That is my general recommendation in trying to decide between the two. But really, remember, it's about what's right for you. I recommend the DOs because you don't have to go to an MD if you need a prescription at that point. The DO is able to do everything an MD can, but instead of just looking at it from a Western medicine perspective, they look at it much more holistically. If you look at the different types of DOs as well, they tend to be from all types of different backgrounds and different ages. I really love that about looking at DO schools and stuff because they really are holistically minded in many ways. I like the concept of a DO. Right now, I see a nurse practitioner as my primary health care provider because I just like her the best. Out of everyone I've met so far in my medical journey, I suppose, my healthcare practitioner as my nurse practitioner, she is outstanding. She's able to have someone above her prescribing range, write the scripts that I need for things, and it works out really well. She has a great bedside manner, and she listens, and she also does not just throw a ton of medications at me all at once. So that is what is right for me in that situation. Now, if I did not have her, I would be seeking out a DO. And when I move, I may have to seek out a DO at that point. But for me, I am good right now with going to the chiropractor for alleviating temporary pain, and I go to my nurse practitioner for treating, depression and anxiety or anything else that I have going on in my personal health and wellness. So you make that decision for you, and I hope that I gave you enough information today to feel confident in doing that. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly. Have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.